Thank you all for joining us for today's webinar. Really great to see everyone. And I know a few people will probably still be trickling in. Before we get started, I just wanted to make some announcements about our upcoming onboarding and mini college, which is just over a month away. Hard to believe. So make sure, if you have not already, to register for the training. So the first day, June 21st, will be the onboarding of our new fellows, and the second day on June 22nd, we will have our mini college training where we will recognize our graduating cohort. Our keynote speaker is Assemblymember Jim Woods, and he will be speaking on June 22nd. And our location is down in Sacramento at the California Endowment, same location as last year. The hotel is a Residence Inn by Marriott. Please make note that the last day to book your hotel room as part of our Champions block is May 30th. And you can go to our website under the events page and find the link to the Eventbrite so that you can register for the training and get all of the details that you need to make sure that you book your hotel room within the next 2 weeks, less than 2 weeks. And really excited, looking forward to seeing everyone in just a month. All right, with that, I'm going to transition over to introducing our speaker for today. We are excited to welcome Stephanie Fulkins with Common Threads. Stephanie Fulkins serves as the Vice President of Programs at Common Threads, which is a national nonprofit focused on the celebration of culture and community wellness through culinary education. She oversees their program design and implementation, strategic planning, and innovation projects. Prior to being at Common Threads, Stephanie was a middle school math teacher in Houston and completed a degree in culinary arts at Kendall College. She's currently pursuing an MBA at University of Chicago Booth School of Business. And Stephanie is also the proud parent of 2 kids who share her love for reading, cooking, and the outdoors. We're really excited to have Stephanie here today and to be partnering with Common Threads to bring you this exciting information about the work that they do that's really well aligned with all that we champion here at the fellowship. And with that, I'll turn it over to Stephanie.
Great. Thank you so much for the warm welcome. I'll go ahead and share screen. Okay. Slideshow. Okay. Just tell me if you cannot see it, but I think we should be. Okay, cool. All right. So my goal today is to introduce you to the work of Common Threads. We have some resources, tools, things like that we're happy to share at the end, but also just kind of walking you through our model, our theory of change, how we work. I hope that brings up some questions, maybe spurs some thoughts or discussions. And then at the end, I know we'll be taking some questions too. So Common Threads, our mission and model. Here's our vision and our mission. I won't read it to you, but essentially we are approaching our 20th year as a national nonprofit. And the way we work is that we partner with schools, community organizations, and healthcare providers to implement healthy cooking classes. Those classes take several different forms, but primarily either we are providing chef instructors or nutrition educators to lead those programs, or we are training teachers and other community leaders to be able to lead the programs themselves. Everything that we do is centered around healthy cooking, healthy eating, and a celebration of culture. And we also build community by making sure everything that we're teaching is skills and experience-based. So we'll talk a little bit more about that, but hands-on is a big theme across all of our classes. So whenever we're talking about health promotion, it's important that we think about multiple factors and the different things that might be influencing a person's behavior. So we think about change at the individual level. How can our classes improve attitudes around healthy food and cooking belief, whether that's a belief in what is healthy or a belief in what their ability is, knowledge, and then behavior. So that skills piece, as well as getting into what is being consumed in the school and at the household as well. But then we also think about how can we support this change at the relationship level? Can we make this a peer-to-peer class where students are getting a lot of time to interact with their peers? Can we make this a family class so that caregivers, aunts, uncles, whomever can also come along and teach with the student or cook with the students? And then we think about the community level too, like rather than having brick and mortar spaces, can our programs happen in schools, in a waiting room, at a community organization? So there's other touch points within the community where the programs maybe aren't just a direct service, but as other people are coming by or people are volunteering in the program, they're also being exposed to concepts around healthy eating. And then finally, we think about the society level. While we as an organization aren't heavily engaged in policy and advocacy efforts, we do a lot on the program evaluation and research side. So ensuring that our research agenda and our policy agenda are aligned to where the field is going and are helping to move some of those policies forward based on what we're learning on the ground. What this means in practice for us, like I said, we have a wide variety of partners that we work with. This work runs from like school districts to federally qualified health centers, to medical schools, to YMCAs, you name it, we probably have a partner in that space. And then the healthcare partnership piece, it's a smaller piece of the pie for us, but it is actually growing quite rapidly, and we're seeing a lot of innovation and growth in that area. So like I mentioned, it's primarily schools, community, and healthcare partnerships. I love this picture on the right. This is from one of the elementary schools we're at. But you can see the students are doing cooking. Like we're not just talking about it, but we're actually making a recipe as well. So I think this little kindergartner is working on a berry smoothie that they were making that day. And then in terms of how we enact this change, I put together this little table to kind of break it down a bit. So on the direct service side, you'll see the direct service programs categorized by partnership type, but just really quickly, essentially Small Bites. This is a nutrition education program where the students participate in a series of 8 one-hour lessons where they make a snack in every single lesson. These lessons tie really well into social studies, math lessons, science lessons, things like that. We also offer the student and family programs. So in those programs, students and their family members are with us anywhere from 2 weeks up to 10 weeks, and they're 2-hour cooking lessons. And each lesson is focused on a different country from around the world, and students get to cook different food, different flavors, different spices from a variety of countries. Lately, the way we've been innovating there is we've actually been starting to tell stories through the menu and the food that's being made. So rather than just cooking from one country, we're going down to the micro level where we have some of our chef instructors or industry chefs are actually crafting menus that tell their own family story of heritage and food. So for example, we collaborated with a local chef out of Chicago, Chef Bill Kim. He is Korean, his wife is Puerto Rican. And so they have this amazing story of Korean meets Puerto Rican food in their household. And so he tells his love story through the menu that the students cook. So it's a way also to learn about people and heritage and celebrate that as well. And then we also offer training for the teachers. So if Common Threads can't be there to implement the lessons, we have, second grade teachers, whomever, getting trained on how to do the lessons in their classroom as well. The community programs mirror that pretty closely. The difference is we see a lot of summer activity with our community partners. So we also have lessons that can be a little more focused on physical activity, that involve food science and some science experiments, things that fit a little bit easier into the summer camp style program. And then on the healthcare side, we have a variety of offerings. It actually begins with what we call our kitchen clinic. This is a pilot for us, but it's a culinary medicine program aimed at high schoolers to talk about the connection between nutrition and chronic disease. And then also open up this idea that culinary does not just have to be a pathway into hospitality. Culinary can be an important pathway into the healthcare system as well. So throughout that course, students are getting to learn from healthcare providers how nutrition is impacting the way they work with patients. And then the high schoolers also have a chance to intern with Common Threads from that public health lens and help co-teach some of our classes. We also have programs that are for providers. So pediatricians, PCPs, gastroenterologists that want to learn more about nutrition and some of that skills-based cooking. We have classes for that. We have patient programs as well. And then we also work on the student side. So through internship, we host students, and then we have a culinary medicine elective for first and second year medical students, as well as residents, where we're co-teaching with academic faculty at that intersection of nutrition and chronic disease, while also doing the skill building of cooking classes. When we talk about change, we think about direct service, but we also think at the policy, the system, and the environment level. So just to give a sense of how an org like us, where 99% of what we're doing is direct service, this is just some of the ways that we think about the PSE change. So at the environment level, this is why it's really important for us to be training educators, so that even if Common Threads can't be at that particular site the next year, there's still people in the building in that space that could implement the programs. It also means that we end up participating on a lot of community coalitions. We rely really heavily on partnerships, so making sure that we're sharing learnings and sharing challenges across organizations so we can learn faster and do better. It also means that we have a full suite of free virtual programs available as well. This was in progress before the pandemic, but COVID really sped that up for us, and now it's available across the country. And it's also the reason on the healthcare side of things, we think it's really important that we do what we can to host different internship programs for dietetic students, for MPH students, as well as collecting evidence for why culinary medicine can be effective in medical schools. We think that can help drive some change in that space. On the system side, what we're looking to do is to start building some capabilities for us to accept referrals from our healthcare partners. So there's a lot of interest in patients when they receive a diagnosis being referred to Common Threads for that education program side, potentially even then pairing that with a VeggieRx. We also work closely with school food to try and see if we can better help with local sourcing. So something we're learning is sometimes the school districts, we work with a lot of large urban school districts, are buying at such bulk quantities, a small startup farm can't necessarily sell at that level. So rather than sell to the school district, they can sell to Common Threads, where we're not looking for those massive quantities, but we're still bringing food into the school. And that's a way to start building that pathway for local sourcing at the district level. And so then in turn, we're also spending our dollars in the communities where the food is grown. And then on the policy side, we'll get into this more, but there's a variety of things that we keep our eyes on and we think about when we're designing, whether it's as simple as a blog or something more on the evaluation and research front, where we're trying to contribute a white paper or something else to the body of evidence. So here are just some of the strategies and the policies that we have prioritized as an organization. And again, we don't do a lot of this work, but we do receive a lot of government funding. So we have opportunity to have some of these conversations, and we have opportunity to align some of the way we measure our program to these. So we pay close attention to the SNAP and the SNAP-Ed policies, making sure those lines of funding are staying open and growing. We look closely at the Child Nutrition Reauthorization Act. So we see a lot of benefit when students, we see a lot of benefit for the students when they can better access the food in schools and that it's more available to them. We closely watch the nutrition guidelines. So we work closely with the USDA as a MyPlate national partner, and then we look at what's happening with the dietary guidelines, how those might be changing. We pay close attention to whole child, SEL, school health and wellness policies, making sure that schools are thinking holistically about children and not just on the academic dimension is something that we talk a lot about. Food marketing as well. So making sure that what's being put in front of students is focused on health and not maybe like higher sodium or higher sugar foods. We promote the culinary medicine work in medical schools, just trying to advance that knowledge and that evidence base for its inclusion. And then we pay very close attention to the 1115 waivers. So how can we use those innovation waivers to help make programs like ours that are focused on nutrition education or Veggie RX, make them a more permanent structure in the CMS system. So we'll do a little bit of a deep dive here on our healthcare partnerships. How we got into this space were these statistics here. So historically, the organization had been primarily partnering with school districts and charter schools. And then around 7 years ago, we got a call from Northwestern University's Feinberg School of Medicine, basically putting this challenge in front of us that many of the medical students upon graduation were failing a basic nutrition test, yet often were the front line in nutrition counseling for patients, and many felt ill or under-equipped to be able to do that. So with Northwestern, we ended up developing a culinary medicine elective for first and second year medical students, and that really set us down this path of exploring and really learning from our healthcare partnerships. I think we got a little frozen. Here we go. Right. Show. So I think it looks like, let me know if you'll disagree, but I think I do maybe have, well, I'll send it after. We don't need to watch the video. But like I said, this started with Northwestern, Common Threads, and Chicago Public Schools. I'm happy to share these slides. But when this program started, it was very early on in the culinary medicine work. I know there's a lot of programs out there now. At the time, there was this program and then one other program running. And so it actually got picked up by a national documentary series, which is cool for us because we can always go back and see what it was at its inception. So I highly encourage you to check out this video if you're interested. It follows both a medical student and then the sixth graders pass through our culinary medicine program. I'll talk why there was a sixth grader too. Let's not watch it though. Okay. All right. So the program itself, the way it's set up, it's a 10-lesson course. 6 of the lessons are didactic in nature. So we have the medical students for 3 hours. They cook with us. It's also a flipped classroom. So ahead of time, they've read some research articles, watched some faculty lectures, and then the students themselves host either a discussion, a debate. They practice with motivational interviewing in the latter half of the course. So we also had a postdoc so we could conduct some research, understand the effects we were seeing from this program. And so here you're seeing some statistically significant change in a positive direction around the medical students' knowledge on plant-based diets, their increased ability and their confidence to prepare those, knowledge around substitutions, and then knowledge around confidently executing those substitutions. So this particular course does reflect a plant-based diet. We found there were a lot of questions from the medical students on this, and like more confidence in cooking the meat, less confidence in cooking the vegetables and the whole grains. So that's why it was designed this way, as well as some of the evidence supporting plant-based diets. And then I just have a few quotes from the students. So part of what they do in the course after they've done those 6 lessons in the didactic nature, they spend 4 lessons out in community. We pair them with a classroom in Chicago Public Schools, and then they lead some of our nutrition education program. And the reason we chose 6th grade was our faculty at Northwestern indicated to us that most practitioners are encouraged to speak to patients at a 6th grade level. You all probably know more about that than I, but so we went ahead and paired the medical students with 6th graders so they could actually have a chance to see what it means, the 6th grade level. Here's a few more quotes. Just I like this top one. I think it's important that they understand the why of it and connect back to the health concepts. And then this notion of a mental toolkit was really interesting to me because there's such limited time with patients, like being able to pull out some tips and tricks really quickly was important for the students as well. So as this has evolved, so has our programming. And so now we have healthcare partnerships on a variety of different levels. I won't take you through this whole slide again, but similar to the one I showed you earlier, this kind of connects the direct service of what we do to the policy, systems, and environment work of what we do. But here you can see there's the high school piece of it. We've also, I do want to highlight, incorporated mental health and nutrition into that program. And then we have a variety of patient-facing programs. These have been developed, honestly, on request of our healthcare partners. The newest one is the cancer prevention one for us, and working with patients who are at risk for cancer, talking about diet and disease with them. And then on the provider-facing side, I think something, we have the culinary medicine elective, we have a version for residents, but something we're increasingly hearing is interest from a single or a handful of providers in a system that are having trouble building champions and winning champions over on the importance of food and nutrition in the medical space. And so we end up doing some lunch and learns or one-off events to start to help open up that conversation as well. Some of the things on the policy and the system side, looking to try and help our healthcare partners do more screening or more meaningful screening around food insecurity, trying to build up our own capacity to accept referrals. And then, like I mentioned, the 1115 waivers in culinary medicine in schools as well. And then here's just a handful of some of our healthcare partners that we work with. So like I said, this is a growing area for us. And each of these partners are doing something so different, because we're just finding each healthcare system is so different in their capabilities, their readiness, and where their interests lie. And so here's a few just simple activations you might want to consider, resources you might want to take away. There's a really great food as medicine map that's linked here that I'll share out, but this is a great way to find out maybe what's already happening in your community. Who are some of those champions? Who are the organizations working in this space? But a great way to find the assets that are already there. We've also just learned a lot talking with community members too, and finding out what they're interested in. That's how our cancer prevention work came up, just in talking with organizations. We heard a lot of interest and a lot of need for someone to start providing some support on the culinary side of cancer prevention. We have some free resources as well. So our on-demand programs, we have a free version of our Small Bites program, so nutrition education that can be done right in the classroom by any teacher anywhere. And then we have a family-based program, so family cooking class posted there as well. We also have online training available for people looking for like a more structured approach to nutrition education. And then you all will get to meet our amazing chef, Mimi, at the mini college. She'll be doing a live cooking class with you all as well, so you can experience in person. And then my information is there. Our social media handles are there. We try and post a lot of helpful resources and things like that. So I encourage you to follow us, and I can take questions now, but you're also welcome. Feel free to reach out, email at any time.
Thank you, Stephanie. That was great. It looks like we're already getting a few questions, your question in the chat. And Fatima, you can also feel free to unmute yourself if you want to ask the question, or I can share.
Yeah, sure. I was trying to frame in the chat.
Oh, hey, Fatima.
Hi, Stephanie.
Hello.
Hi. So I just had a question. So when you partner with a healthcare organization, what do you seek in that partnership? Like, do you look for clinics that already have an existing food as medicine program? And then I don't put this in the chat, but what are the expectations on the healthcare side as well? Like, do they have to refer a certain number of patients? And kind of, if you can kind of walk that through, like the actual process.
Yeah, it 100% depends on the partner and where they're at and what their interests are. So I'll give you a couple examples. We have a partnership with University of Washington out in Washington, but on the West Coast. And they originally wanted to try and do patient-facing program and provider-facing program, where what we would have been asking for them was the space to host classes, or whether or not it's going to be on Zoom. It was going to require a decent sized budget. It costs us around like $3,000 to $5,000 to run an on-site class for 10 weeks with the providers. And ultimately, from all those conversations, we learned that the budget wasn't really there, but nor was the readiness He was kind of operating as a solo player. People weren't really interested in signing up, really weren't interested in diverting funds that way. So we ended up just doing a combo provider-patient series of one-off classes. So now once a quarter, we're on Zoom, we're cooking with whoever cooks, and then he's able to use that to keep having conversations. So for him, I think, you know, it's, we went after a pretty small grant to make it happen, and then he promotes it and we host it on Zoom, and it's very simple. Versus we have an FQHC partner, a federally qualified healthcare partner, who already was doing a family diabetes clinic, who was already doing a fitness clinic, who was already doing nutrition classes, but their staff was so tapped. They were all at capacity and they wanted to do more for residents. They wanted to do more for patients. And so they're leveraging us to provide some capacity and expertise on the resident education side and then on the chef side as well, because they just have one dietitian and she can only do so much. So that's an area where we can come alongside them, do almost similar to what they've been doing, but we can provide some additional support. And then we have partners who had no elective in the medical school. So we're just helping take what we've learned from other partners and helping them navigate that elective approval process, what the budget might be, how to recruit students, how to pick students, things like that. Does that help?
Yeah, thank you. Thank you for the explanation.
Mm-hmm. Yeah.
Really helpful. Any other questions? Feel free to write them in the chat or you can unmute yourself. And as folks are thinking about any other questions they have, I guess one area that I'd love to hear you expand a little bit on, Stephanie, is I know there's quite a bit of interest in kind of school-based interventions, and I'm curious if you could talk a little bit about those partnerships, and then have there been any experiences. And I'm thinking about when you were doing sort of this training, I love the way you guys tied that into the sixth graders and having the residents and trainees kind of in that setting as well. And I'm just wondering if you have other examples of how you've tried to sort of sustain those collaborations and what has that experience been like?
Yeah, a few things, and just steer me another direction if this isn't helpful. But on the school-based side, the way we've worked with academic departments on the STEM side tends to be pretty popular. The schools see cooking as a really hands-on way to make fractions come alive, to make science come alive. We've had some partnerships come out of like the ELA or ELL, so English as a second language population too, where they feel like there's something powerful in talking about culture and food, but also the practice of having a recipe, reading a recipe, following a recipe can be powerful in ELA. So that's been a key piece for us, is the schools, it can't just be about health as much as we would love to see schools prioritizing that. Like, they also really need to make sure students are where they need to be academically. And so to the extent that we can connect to those core content areas really makes a difference. The other thing we've seen on the school side that helps is a lot of the school wellness policies that have been in place. You see them, they really run the gamut in the districts, and I'm speaking about the large urban school districts. That's primarily where we work. We have some district partners who wrote them when they were required. I think that was back in 2008 under the Let's Move campaign, and I don't think they've been touched since then, or you request them and it still has like track changes on it, like it's not really happening, all the way to other school districts like a Chicago Public Schools, where it's manifested as an indicator and a grade for the school. So like a parent, you can go in and see what dimensions of health that school is achieving, but that can be another strong way to partner with schools because it is something they're required to do. It tends to be an unfunded mandate, but then being able to help them achieve that is important. And then the other connection I would highlight between schools and providers, we had one partnership where we actually worked with a group. It was women in cardiology, so one of the interest groups in a hospital partner, and the cardiologists came, volunteered in some of our cooking classes, and then as the students were cooking, they were talking about the connection between food and heart health And then as the students were eating the meal together, the cardiologist provided stroke awareness training. So sometimes students end up being the first responders when an adult has a stroke or a heart attack. And so equipping the students with what to look for and what to do, that was an interesting connection point as well. Yeah, should I answer the question in the
Yes, yes.
chat?
I have a question in the chat
Okay.
about resources for grant funding. And feel
Yeah.
free to unmute
So
if you'd like to expand on the question at all.
yeah, is it Linnell? Feel free if you want to come off mute. Our primary sources are philanthropic dollars and then government dollars. So on the philanthropic side, that also would include corporate partnerships and things. So some of the corporate dollars will often come through like marketing or ESG, so environmental sustainability goals, things like that. And then on the foundation side, it's a whole slew of foundations, but ones that are particularly interested in like food access, health equity, or education tends to be where we have success. And then on the government side, so Common Threads is national. We have operations in LA County, but we have operations in 9 other markets as well. So in a handful of markets, we're a SNAP-Ed provider, and then we also have some local county dollars that come in, and then we have been able to access some of the funds that are flowing from COVID relief. So some of the ESSER dollars that went to schools as an after-school provider, and then some of the ARPA dollars, so American Relief dollars as well, since there's that connection to health equity when you start talking about food and nutrition education. But we don't charge participants for program. That's a question that comes up. So some of our partners will pay, but our participants always have access for free. Yeah.
Looks like, yep, sounds like that answered Linnell's question. And you spoke a little bit, Stephanie, about evaluation, particularly around the healthcare intervention where you were training. And I'm curious, what have you guys been able to gather from evaluation of participants, and what sort of feedback and how has that helped shape your programs moving forward?
Yeah, so the primary way we've done evaluation is self-report through pre and post surveys. So in those surveys, we're looking at knowledge change, behavior change, and attitude change. We see everything in a positive direction. I guess it's what you would expect, because if we saw it in a negative direction, we would change the program. But something we have seen over the years is like the baseline that students are coming in with has risen. So there's been a lot of work in this field. So students are coming to us more knowledgeable, particularly about fruits. They know a ton about fruits. So we've actually had to drop and change our survey over time, take out the fruit questions and put harder questions in about whole grains, protein, and vegetables to like understand if we're moving the needle or not. So that's been encouraging to see. The other way we do research and program evaluation is more qualitative. So talking to participants, understanding like what their experience was, where they're at. I would highlight like 2 trends of interest there. One, just like there's been growing interest in the field. Like people, I think, are really starting to understand the importance to emphasize on their health. It's a lot. We didn't hear it as much. I've been with the org since 2011, so I didn't hear it as much when I first joined, but now something I hear a lot is this idea that like either you invest in your health now and you pay for it in food and time and cooking, or you're going to invest in your health later when you get sick and it's all going to go to the healthcare system. So there's been this sort of like economic mindset about when you invest in your health. And the other thing that we've seen, this is more related to like food access and food security. It's still a major problem. But when we were doing classes years and years ago, we didn't have questions around like kale or like all of that. It was like there were these more specialty ingredients, kale, quinoa, chia seeds. Now, especially, I notice it's like tied even as you start to see some of like the Aldi's pop up in neighborhoods. Now, when we go to participants and ask, what do you want to learn? oh, we want to learn about kale, we want to learn about chia seeds. So that's encouraging, like from the culinary perspective, that there is starting to be some more interest in these more like what used to be specialty ingredients. And we have parents that will then tell us, well, it's like worth it to me if I have to drive out of my neighborhood, I understand, but I can get the better produce or the better seeds. So that's been interesting for me to like watch over time what ingredients people are interested in cooking with.
Yeah, I think that that makes sense. There's been sort of this evolution, and I think quite a bit more, some developing awareness, but to the stats that you point towards, still quite a bit of learning that needs to happen. Yeah. And sort of one other, question that's coming to mind as I'm thinking about our fellows, and we may have some of those similar providers to the one that you ran into at University of Washington, where they're really excited about the change and they're ready to go, but they don't quite have the buy-in that they need yet. And is there advice that you have for building that? You mentioned the lunch and learns. Is that something that's been like a successful way to kind of get people to garner interest and then build something into more of a systems and environmental change that they want to see?
Yeah, I think the one-time classes can be really helpful if you can get folks to come. That matters. I would also point to, there's a lot of evidence coming now too around the connection of nutrition and chronic disease. I think especially we're going to see more of it. For those of you following, the Biden administration had their conference to end hunger, and a key strategy there was like nutrition and healthcare. So we know NIH and CDC, like there will be investments in that space more. So there could be a lot of evidence to point to. Some of the states, I think, including California, like those 1115 waivers are in place. So there'll be great evidence coming there. But then the other thing I would not negate is just even the power of building relationships with key stakeholders at like the one-off level. So the example I'll give, one of our healthcare partners, we needed access to the kitchen space of the hospital. And they were kind of like, yeah, sure, fine. Like you can go to this baking kitchen way in the back. But they're like, you're just doing your crazy vegan thing. Kind of like they kind of just like brushed us off. But then the director was coming by one day, and like the power of food and hospitality, we just made him a plate where he could try the plant-based meal that the medical students made. And he was like, oh, this can actually taste pretty good. Like maybe our hospital should think about this. And I can't like point to some policy that came out of that, but he had told us at the beginning that he only eats steak and that's all people really want to eat. Like that was his attitude. And then, but the opportunity to try something can be really powerful. I saw it with a school food service director I worked with. She didn't believe the kids would eat healthy food. So I invited her to come by class one afternoon. She came, she saw them like chowing down on the salad they had made. And from that, she decided to change like all the vending machine content. So kids will eat it. So I would just not negate the power that food has in the hospitality space and the power of sharing a table too.
I love that. I think, more on that to come for the fellows as we're kind of thinking about the work that BMC is doing around messaging and persuasive narratives and how we tell those stories. That's just such a great example of how you can kind of build those relationships. And oftentimes it's not really about the numbers. It's it's just really the story that you tell and giving that experience to someone and kind of changing their mind in that way.
I do have a quick question, more personal for me actually, or because I do have children. I'm curious, with these types of programs that you touch on with high school students, what I do find is that it's great that they can get that experience to try different things. But then as they get older, I think there's some confusion, or they're just not as literate when it comes to labels. Do you touch on that at all? In terms of some type of literacy on how, hey, that's too much sugar, that's too much sodium. just giving them a baseline of what to look out for.
Yes. So in all of our small bites lessons, I believe it's the 4th lesson or something like this, we dive into the nutrition label. And so the bulk of the education we're delivering is pre-K through 8th grade. So how that nutrition label varies by grade level, but it becomes a big part. It does deeply resonate with the middle school set. There's this like sense of justice that bubbles up, like, wait, but the front of the package said healthy, which I hear that term is getting defined by the FDA, but the front of the package says healthy, but then when I turn it over, it's clearly not. Like, they get upset about that, which is it's like a righteous anger that the middle school students have. With the younger ones, like sometimes we'll focus a little bit more on serving size, like looking at this, was this package intended to be just for one person, or like how much is really a serving here? That can kind of resonate. But yeah, the labels are really a really powerful thing. And then with the adults, they like the nutrition label, but like what does it mean if they can call it low or high fiber? That they tend to key into as well.
Thank you.
And one other area that that comes to mind, Stephanie, we have quite a few folks that are interested in screening for food insecurity, have been able to kind of implement programs to do that, and are starting to work towards connecting that. We really push them to connect that to resources. And I'm just wondering if you can say anything more about how you guys have been able to do that, or how you are planning to, if there are more things that are happening in that space.
Yeah, our interest in this space will probably be more along the lines of a patient screening both for a chronic condition and food insecurity, so we can deliver some of that patient-specific classes. That's a lot like constrained to our own capacity to do the research and secure those funds. There's also a lot of players in the food access, food security space for the general population. A resource that I would point to if you're in the process of doing the food screening, but then where are you sending those patients if they're screening positive? Feeding America has a great study. It's called Mind the Meal, or the Mind the Meal Gap, or I can look it up and send it. But there you can like start to see food stats, and then you can also look at their map of food banks in the area. And I know a lot of food banks are seeing a lot of progress in terms of mapping with healthcare providers and doing the referral system. The other organization I'm less familiar, but I know they do a lot in this area, is Unite Us. But they're powering a lot of the food security referrals too, between community organizations and food providers as well. So they might be someone to connect with or to look at their resources too.
Great. And we've had some models where folks have partnered with Feeding America and had some good success there.
Mm-hmm.
Any other questions? As we're getting closer to wrapping up. And I don't know, Stephanie, we have a few minutes. So as we, if people have more questions, feel free to ask. But if you want to share the video, the short clip, you can feel free to
share
it, and we'll,
sure.
Please feel free to continue to type any questions in the chat that you guys have.
Okay, let me share. All right.
In our neighborhood, there's a lot of junk food and not much healthy food, and that's a problem. My mom, she was getting aches and pains and not wanting to get up in the morning and being tired and things like that.
I can't let the arthritis prevent me from working because so many people are depending on me.
The doctor told my mom and my grandma. In our neighborhood, there's a lot of junk food and not much healthy food, and that's a problem. My mom, she was getting aches and pains and not wanting to get up in the morning and being tired and things like that.
I can't let the arthritis prevent me from working because so many people are depending on me.
The doctor told my mom and my grandma to modify their meals.
Let's go. I would stop at fast food restaurants, eat in the car, we get home, we do the homework, go to bed faster. It made sense time-wise. You guys put your seatbelts on.
Okay.
And it dawned on me, how much am I spending? And it's not healthy food.
So I'm going to start by giving each of you guys 4 cards.
We're learning about healthy food. Half of your plate is supposed to be fruits and vegetables. A quarter is supposed to be protein, and another quarter is supposed to be grains. Learning about simple recipes gave me more confidence to be able to do it by myself.
Okay, so I have the list.
I like being in the produce section because it's the one place in the store where you don't have to worry about something being unhealthy for you. You don't have to be the top master chef, but you can actually cook something that's good and it's pretty easy to prepare also. Avocado oil.
I wanted her to fry the chicken tenders, but Hayden is about being healthy, so she chose to bake them.
Chicken is in. I feel like my sister is more likely to eat healthier food if she helps prepare it.
Pretty color.
It's done. Yay! Being able to give them something that I prepared for them, that was really fun. They actually enjoyed it.
Our forefathers and mothers didn't have access to health care. They had to use what Mother Nature offered. And it's really exciting to know that the medical field is now seeing that we are our own first health care provider.
And then the full version is in the link if anyone wants the medical student side.
That was great. Thank you so much for sharing that, Stephanie. That was awesome to see. I think really nice way to see the impact of this work. So if we have any other questions, feel free to ask. I see a question about watching the recording of this webinar. So we will post this on our website. And if you look under resources, you'll find a listing of our webinars. Give us about 2 weeks to make sure it's posted, somewhere around 1 to 2 weeks, and you'll be able to see the webinar and also the slides, which Stephanie will be sharing with us as well. That'll be posted, so you can find all of the resources that she's mentioned there. Okay. Well, thank you so much, Stephanie. This has been really, really wonderful, and I think just a great way to see some of the possibilities for the work that many of our fellows are interested in, and align so well with what we're doing. And we're really looking forward to continuing the partnership with Common Threads and seeing you all at the mini college.
Same. Thanks so much for having me. And if I can be a resource, just reach out.
Great. Thank you.
Thank you all.
Thank
Bye.
you, everyone. Have a great rest of the day.